There have been studies shown when they have done PET scan on individuals who've getting less than 6 hours of sleep, they were more likely to have those proteins deposited in their brain, which are linked with dementia as compared to folks who were getting 7 to 8 hours of sleep.
Welcome to Baptist Health Talk, a podcast on all things healthcare, powered by Baptist Health South Florida, your trusted source for healthcare prevention and wellness.
I'm your host, Nikki Mohan. Welcome back to a new episode of Baptist Health Talk, where we answer your most searched questions on trending topics. In this episode, we're unpacking the science of sleep, how it affects your brain, heart, and overall health, and what you can do to improve it. We're joined by Dr. Rachel Rohidi, psychiatrist at Baptist Health Miami Neuroscience Institute, and Dr. Harneet Walia, medical director of sleep medicine at Baptist Health Miami Cardiac and Vascular Institute, and chief of clinical transformation at Baptist Health Medical Group. Thank you for both being here, doctors. We're going to dive right in. We're going to start off with Dr. Walia. We often hear the phrase, what's good for your brain is good for your heart. How does sleep fit into that equation?
Well, sleep perfectly fits into that equation. Sleep is vital for brain health and heart health. During sleep, our blood pressure regulates. When we go into non-REM sleep, the blood pressure declines, the heart rate declines, the breathing stabilizes. Sleep is also during the time when our memories get consolidated. It's the time when we are clearing out all those bad toxins that get accumulated during the wakefulness. Our body is recuperating. The body is revitalizing. It's conserving the energy. So it's vital for both brain and heart health.
Amazing. And Dr. Heidi, there's growing research that says linking sleep apnea to an increased risk of dementia. Can you talk about that and explain the connection and why this matters when we think about long-term brain health?
Yeah, absolutely. So when we think about sleep apnea, we're talking about a lack of oxygen in the brain, hypoxia, right? And we're also talking about fragmented sleep. So all of this definitely affects the entire body, affects the brain, affects long-term health. So when we're looking at possibilities of cognitive decline, things like Alzheimer's and vascular dementia, we're looking at what that effect does on the rest of the body, the lack of sleep, the lack of oxygen, the fragmented sleep. So we think about things like cell health, cellular health. So the health of the arteries, of the veins, depend on the oxygen that we are able to have in our body, right? So we're looking at an increase in vascular dementia, an increase in cognitive decline. The fragmented sleep, not getting enough sleep, right, really also affects our mood, affects how our reactions during the day, how we plan out our days, our emotional regulation. So all of it is vital.
Wow. Sleep is important. And Dr. Heidi, we also hear that men and women experience sleep differently. I know this from a fact. Sometimes it's like we want to go to sleep earlier. They want to stay up all night. But then I have a lot of female friends that want to stay up all night. What are some of the key differences and what are the key differences in men and women? And how does that influence how we approach sleep?
Absolutely. So, women are vastly different than men. Women have hormonal changes. So we have menopausal, right? We have pregnancy. We have the time when our hormones are coming into play. And
women with newborns.
We have our menses, right? So all of those hormonal changes play a role in how a woman sleeps. And we know that a woman being more in the luteal phase of her cycle will have better sleep. Somebody in their follicular phase, right after, they tend to sleep a little less. But I think women overall have better sleep than men. We sleep a little more profoundly than men, but yet as we age, we tend to sleep a little less, right? Especially with the hormone changes in menopause. We're also a little more at risk for restless leg syndrome, where men are a little more at risk for obstructive sleep apnea than women usually. So there are definitely differences.
Yeah, you hear the term sleep divorce a lot now, and that probably has a lot to do with it. Back to Dr. Walia, what are some of the short-term and long-term consequences of not getting enough sleep when it comes to your heart, and how much is really enough?
Yeah. Insufficient sleep or sleep deprivation is highly prevalent. In fact, a third of United States American population is sleep deprived. And sleep deprivation is associated with a whole host of consequences, associated with short-term consequences such as impairment in mood, concentration, excessive daytime sleepiness, fatigue, irritability, can't work properly, decrease in productivity. Some of the long-term consequences could be related to overall brain health and heart health. Sleep deprivation is linked with higher risk of dementias. There have been studies shown when they have done PET scan on individuals who've getting less than 6 hours of sleep, they were more likely to have those proteins deposited in their brain, which are linked with dementia as compared to folks who were getting 7 to 8 hours of sleep. Sleep deprivation is also linked with increased risk of obesity, diabetes. We tend to crave junk food, increased risk of high blood pressure, increased risk of rhythm problems, also increased risk of death. Well, there have been studies that shown that folks who sleep before their vaccine have a more robust immune response compared to folks who get less sleep before getting their vaccine. So it has a role in also in immunoregulation.
Yeah, Dr. Heidi, can you chime in? What about how all of this affects the brain?
Oh, absolutely. So, when we are not able to sleep correctly, when we are deprived of sleep, we're unable to really think clearly in the morning. We're less able to regulate our mood. And we see a lot of effects of that. A lot of issues with anger, depression, anxiety. We see a lot of issues with substance use as well, because we're trying to get to sleep. And so we're using, cannabis, or we're using wine to help us to sleep. So it affects, I think, not just the brain, but whole body. We're looking at also affecting others, right? So if we're not islands living on our own, if I'm not sleeping well, I may be a little more irritated, a little less patient with my younger kids or with my husband or my partner, whatever it may be. So sleep deprivation has effects not just in the person, but I think family-wide. And we see it at work as well, right? So a decrease in productivity at work, decrease of grades in school. And so I think when we're looking at sleep, we're looking at whole body health. Yes. Whole life health.
Sleep is a superpower. How about from memory to mood and decision making? Can you share some of the insights on the research?
Oh, absolutely. So research has definitely shown that, especially with memory, that lack of sleep can definitely stop or not allow memories to get consolidated, right? So if we're sleep deprived and we're trying to learn certain things, so let's say we're going to school and we're trying to learn whatever it may be, we're going to be less able to recall that information, less able to produce what we needed to produce. And so it definitely can affect our memory. It affects mood. So we know that if we're not sleeping enough, we're more irritable, we're less able to regulate our mood, we're more impulsive, and more apt to develop things like major depressive disorder, anxiety disorders. And so absolutely, it again affects whole body, whole life.
Amazing. Dr. Walia, back to you. Is there really a magic number for how many hours we're supposed to get? And when it comes to sleep, is it about how many hours? Is it about sleep quality?
Well, sleep needs vary among individuals and across the lifespan. On an average, an adult requires 7 to 9 hours of sleep on a consistent basis. Now, somebody may be a short sleeper, somebody may be a long sleeper, but this is based on all the evidence that is out there, which is 7 to 9 hours of sleep. And sleep is also multifaceted. Sleep duration is one thing, but there's also sleep quality. There's also sleep timing. There's also sleep regularity. There's also the daytime consequences which are associated with sleep. So yes, optimal sleep duration and quality of sleep is of utmost importance for optimal health.
Wow. Dr. Heidi, you have experienced personally in this area, parents, especially those who have very young kids, often run on very little sleep. What are some of the advice you have for those parents, and what are some of the consequences of running around on very little
absolutely.
sleep?
So, parenting tips, this could be a whole other show, right? So definitely.
How did our parents do it?
I don't know.
My grandmother had 12 kids.
I have no clue. I don't even know how I have the 3 that I have. It's just and able to function. So it's certainly routine. I'm a big proponent of routines. Getting a sleep routine. So we know that those, bath, brush, books, and bed, right? And so if you're getting small children, and please, it doesn't mean that I actually did it, right?
You attempted. It was a thought that counts.
Exactly. You do the best that you can. But certainly having a routine early on is going to really set you up for success. But not only helping your children, but it helps you. And then I know that there's this debate, co-sleep, not co-sleep.
Right.
Some people are up in arms
I say
about
sleep
it.
by any means necessary.
Absolutely.
So if it meant bringing my kid into the bed with me, then that's what we were doing.
So for small kids, setting up a nice, comfortable, safe bed area, sleep area for them is going to be very important. And for some kids, sleeping with their parent is their safe space. So if that works for the child, take advantage and sleep, because that's going to help you sleep as well. Instead of fighting with your child for 5 hours trying to get them to sleep, and then the child goes to your bed and then you bring them back, and it might work for some, but I know, especially from experience and I still am dealing with some co-sleeping issues, but allow them. If that's going to get you to sleep, then you're going to sleep. So I think whatever works for that family, but certainly setting up early routines and schedules is going to set you and your children up for success down the line.
You have anything to add, Dr. Walia? As a parent yourself?
Yes, I've had a first-hand experience myself, but I have to remind myself and my family too that sleep is a priority.
Yes.
We cannot have sleep at the back seat. So like Dr. Rohedi mentioned, having a good sleep hygiene is of utmost importance. We have to ensure that we are getting good quality sleep by getting 7 to 9 hours of sleep at least for regular adults, and for teenagers 8 to 10 hours of sleep, and having a good sleep environment.
Yeah. For someone who wakes up in the middle of the night, Dr. Walia, and I know I do it, and I think it's because I'm in that phase of my life when my hormones are everywhere. What do you recommend to help people get back to sleep and to get back? Because I find if I wake up at 3 a.m. and then I fall back to sleep, it's not quality sleep. And then I feel like I've only slept 2 hours instead of the cumulative, maybe 7.
Yeah. So it's very important to know why somebody is waking up. They may be waking up due to underlying medical conditions or hormonal changes during menopause or hot flashes, like medical conditions I mentioned due to COPD or cough. If that's the case, then those conditions needs to be treated and addressed. Somebody may be waking up due to underlying sleep disorders. For instance, sleep apnea can wake people up. Restless leg syndrome, or those leg movements in the middle of the night, can wake people up. So we have to look at the root cause of the issue. But typically, if somebody is waking up, we tell them that if they've been in the bed for more than 20 minutes or so, in their mind, they should leave the bedroom, do something uninteresting, come back to bed only when they're sleepy. The whole idea is we want to train their mind that bed is just to sleep. It's not there to lay down or think about stuff and so forth. And no clock watching, by the way, because that can have paradoxical effects.
It's the worst.
Yes.
Dr. Heidi, any tips to add for yourself?
Oh, no, I agree. Absolutely. If you're in bed too long, you're basically teaching your body it's time to play. You have to get up, sit in a chair, make a tea, do whatever it is that you're doing, as long as you're not activating yourself, right? So we don't want to watch the rest of that really cool show that we were watching.
Or the phone.
Right. Exactly. So we want to make sure that we're not also teaching ourselves that it's okay to be awake in bed.
Yeah. You're big on sleep hygiene.
Huge.
Talk about your sleep hygiene and break down. It's the 10-3-2-1-0 sleep method.
Oh, yes. So 10 hours before sleep, you're not to have any caffeine right? So no
Oh.
caffeine. And so, I'm certainly the café con leche right before bed kind of girl sometimes. So I break that right away, unfortunately. And then, 3 hours before sleep, you're supposed to not have a heavy meal or any alcohol. It was 10-3-2, right? So 2 hours before sleep, so basically it's trying to get you to not see your screens or TVs. I think that's the 1 hour. I forgot what the 2 hour one was.
It's okay.
But it's again, structure.
Yeah.
Making sure that you're doing something to ease you into sleep. So just like, and I learned this, with my kids, you can't expect them to do one thing and then quickly, without any interruption, switch to something different. That just doesn't happen for kids. And it doesn't happen for me either. So I need some kind of routine to help me kind of slip slowly into that sleep mode and get myself to sleep. I can't just go from 60 to 0 in 2.2 seconds.
Yeah. My new thing is
doesn't
sound
happen.
baths. I listen to sound baths.
Oh, that's
and
good.
That's the way I try to wind down. Dr. Wally, we've all pulled an all-nighter or two at some point, right? Medical school, college. And from a clinical perspective, how bad is skipping a night of sleep?
Yeah, we've all been there, like you said. And one-nighter is not going to ruin your health, but we have experienced the consequences, right? Even one night of sleep deprivation, we feel irritable, we can't think clearly.
Can you catch up?
Well, you can catch up. It's better than being chronically sleep deprived. So there are some data to suggest that when you catch up, you can overcome some of the negative consequences. But over time, the sleep debt builds up. So it's like, having a consistent sleep-wake schedule during the weekdays, during the weekends, during the days you're working, during the days you're not working, and having that good duration of sleep, which is 7 to 9 hours of sleep, is of paramount importance.
Yeah. Yeah. As you said, we live in a very sleep-deprived society. Dr. Rahai, do you have breathing techniques that you teach, like the 4-7-8 method that's gained popularity for sleep and battling anxiety? We hear from teens these days, I'm anxious. I'm anxious. It's, but breath work?
So absolutely. I mean, it's very similar to, some of those little things that we got during COVID, where it was like a little box and you have a little figuring and it's like this box breathing. And so you breathe in through your nose for a certain amount of seconds, you hold it for another certain amount of seconds, and then you release through your mouth. And so I think that kind of meditative breathing technique can really be helpful. And you can teach that to your kids too. So I think that they can help decrease that excitatory feeling that we have, right? The anxiety, we're revved up because of something. And so if we do this breathing technique, I think it can be very helpful before sleep.
Fantastic. Dr. Wally, what's your take on all the popular sleep aids? We like magnesium and melatonin. Do they help, or are there risks for people may not be aware of? I know first you're like, get diagnosed, find out why you're not sleeping.
Yes, always looking at the root cause of the issue. And melatonin is actually a dietary supplement in the United States. And it's more useful in patients where we want to shift their rhythm, the day and night rhythm. For instance, if somebody is a night owl, they want to sleep late and wake up late. Timely melatonin can help shift their sleep-wake rhythm to an earlier time. It can also be helpful for morning larks, for shift work disorder, for jet lag disorder. It can help a little bit in folks who have chronic insomnia, but the studies have shown that it helps in a very small quantities. And overall, I would also want folks to be aware of the dosage of melatonin. The normal physiological melatonin is in picograms. So what I'm trying to say is that if somebody has to take melatonin, it should be in the lower doses. So similarly with magnesium. Magnesium is supposed to relax the body. So there are some data to suggest that it may help promote sleep, particularly in restless leg syndrome. But overall, it's not backed by robust scientific evidence.
Wow. Yeah, no, and everybody's selling it. It's everywhere and not really understanding. And that's why we have you two here. This has been such a great conversation. You guys look both well rested.
Absolutely.
So I wish you great sleep. Thank you so much for sharing your insights today with our audience. Remember, viewers, be sure to hit that subscribe button on our channel here to keep up with all the latest health and wellness information and tips from our experts. Thank you so much for watching.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Baptist Health Talk is brought to you by Baptist Health, the warmer side of care.